Welcome back to the Colorectal Surgeon. I am Dr. Samrat Jankar. I am a colorectal surgeon based at Pune. November month we are celebrating as a piles awareness month. So we are creating a daily one video with respect to piles on different aspect. So today's video, right posture in the toilet is the one important factor to prevent the piles formation. So when we come to talk on the piles are nothing but venous cushion which are there in the back end passage at the anal region, which will get swell due to a persistent pressure put by a person. Usually what happen, chronic constipation or sitting longer time in the toilet, putting more pressure and leading to swelling of the anal cushion, and that leads to formation of grade 1, grade 2, grade 3, grade 4 piles may be associated with pain, bleeding, all these things. We know all these things. So is the piles is a day affair or 2-3 days problem it is coming? It's not. It is a month or years we have been following wrong posture in the toilet, and having a wrong toilet habit is one of the reason for the piles. In fact, one of the good study has been done by Stanford University has proven that squatting position in the toilet is better than the sitting position. That's Indian toilet type is better than the Western toilet type in the toilet to help for all the bottom problems, to avoid getting bottom issues. If we are sitting in the toilet, particularly in a sitting posture on the Western toilet, what happens is we need to strain. The anorectal angle is acute, the pelvic floor is not relaxed. Person has to put the pressure to evacuate more than the squatting position. If person is sitting in the squatting position, that is Indian style, and if at all we are doing that way where knees are flexed and bit above than the chest level or near the chest level, and we are leaning a little bit forward and taking a slow deep breath, that helps to obtuse the angle, widen the angle, and rectum and anus become in one line. Pelvic floor relaxes very good way. Because of that, evacuation will become very easy, and that is one of the factor. If we are doing daily daily matters, evacuation daily we are doing in wrong way or in Western toilet or sitting position in longer duration, that might be one of the reason for your piles. What to do now? If we are having squatting posture sitting in the toilet, that's the Indian toilet, that's well and good. If not, you can use stool which you can keep below the foot, so that your knees will be raised and lean forward and evacuate, and keep your timer. Don't sit for longer. Might be 5 to 7 minutes is acceptable to sit to evacuate, but pressure is not coming. I will put pressure and I will sit and evacuate only and go. That is a wrong habit. If someone is using a mobile, reading the newspaper, chatting on WhatsApp, surfing on the social media, and sitting in the toilet thinking something, all things are wrong. Because in toilet, when you go and sit, your brain has to coordinate through the spinal canal to your anus and rectum, and the urge has to reach to the brain, and brain has to make pelvic floor to relax, and rectum has to push, so that evacuation happen without knowing. And that is one of the very important thing which happens in our brain. If we are diverting our mind towards something to get that 10-minute or 7-minute productive into some other work, we are hampering a natural mechanism to calm down our brain. In fact, doing normal motion is something called mindful motion. Mindful motion is we are sitting in a squatting position, allowing our brain coordinate with the pelvic floor and rectum, and pelvic floor relaxes, rectum pushes, everything get out without much effort. That is something called mindful defecation. That is one of the factor everyone has to develop, so that most of the problem related with anus and rectum, starting from the piles, fissure, fistula to the colorectal polyp and even cancer, can be significantly reduced. So friends, toilet posture, toilet habits are most important to prevent your piles. If you are doing wrong, you don't have piles, change it, otherwise you have to suffer. And if at all you are suffering, change your toilet posture. It is one of the major contributor for your piles problem, and it will help you cure from the problem. I hope you understood a little bit about toilet posture and piles. If you are benefited from this video, like and share our video, subscribe our channel The Colorectal Surgeon. Don't forget to watch tomorrow video on another topic of piles to understand more better. Thank you. Thanks a lot.